to get started here. Obviously, a lot has been going on with COVID-19. We're seeing like a huge resurgence in cases. And Atul, a good friend of mine, I just wanted to kind of bring him on board and just kind of discuss like what he's seeing and what are some things that we can do. I think we had a conversation last night. There's a lot out there, and I think there's also a lot of noise. And I think there's just, so many things that we need to do to act and also educate and inform our friends and family around us, as we move forward so we can get out of this as soon as possible.
Thank you, Harrison. First of all, it's a pleasure. You're someone that I go back with, almost 2005 since we were freshmen in Hillcrest, bro?
Yeah, man, Hillcrest.
You remember that N200? Harrison and I go back to the N200s in Hillcrest. I was for 15 years. So as dear a homie as anyone can be. So honestly, it's awesome to be able to just do this. You're in SF, I'm in LA. We're both raised through our Iowa college days there. So very cool. But yeah, you're right, man. A lot is going on and there's so much to say and we're seeing an unfortunate resurgence, and I'm happy to get into that. I'll just give a quick update, and then we can kind of have a conversation. But our governor Newsom, we just ended up declaring yesterday into today, closure of the restaurants, any indoor restaurants, movie theaters. Unfortunately, we're stepping back in terms of the phases of the reopening, but we're seeing that across the country. We saw it Texas, Florida. So there's big questions of like, why is this happening?
Yeah.
And I'm happy to get into that as well, Harrison. But you're right, it's an unfortunate situation. We're going into the 4th of July holiday, and unfortunately we're seeing a rise of cases. Dr. Fauci, mentioned we could even hit 100,000 cases a day, which would be unprecedented. We're at like 45,000 a day right now.
Yeah.
So uncertain times, Harrison.
Yeah. So before we get into all the questions, just give folks like a quick background. I know we talked about our relationship, but it'd be great to just catch everybody up in terms of just like what you've been up to and your role in, being in medicine during this pandemic.
Yeah, I've seen nothing like this. I mean, I've just seen nothing like it, Harrison. I've been, between 4 years of med school in the medical setting, 3 years of residency, and 2 years practicing now. In those, 8 or 9 years, I've seen nothing like this.
Yeah.
In so many ways, the emotions, what patients are feeling, the fear, the anxiety, the uncertainty. So just a little bit. So the sentiment is just something I don't think many of us in medicine have ever experienced,
Yeah.
even people who have been in the field 20, 30 years from those I talked to. But just to give a little background for folks, so I serve as a primary care doctor for an underserved community in South Central LA, the Compton Watts community. We have a government-run public clinic. We take care of anyone, everyone, doesn't matter who you are, where you're from, how much you can pay. We take care of you. So that's my primary duty. And we're seeing a lot of COVID disparities within that community. I can talk about that. And then my second role is I was one of the physicians in our COVID-only hospital that was built and funded by Governor Newsom and the Board of Supervisors. It was already a hospital built before, but it was reopened under the political leadership of the state. And I served with one of our amazing ICU nurses, Christine, who's on this IG Live as well. We had an amazing team there. And then my third role has been as an advisor to our county's health system. We have 4 hospitals and 24 clinics. We're the second largest public health system in the United States, take care of 600,000 patients a year. So to be on the systems level, handling a pandemic crisis, so many challenges from PPE to testing folks, to screening people, to protecting our workforce on the front lines. So those are just to give people a little background, those are the 3 kind of hats, roles perspectives I've been able to appreciate during this pandemic.
Yeah, and I would probably say too, you've also advised sort of a few high profile sort of folks as well. Maybe kind of give us some idea of like that as well.
Yeah, I've been really fortunate. I had the Academy Awards leadership and staff reached out to me. Don Hudson, a dear friend who's done amazing work. I mean, one of the hardest jobs thinking about, we're in LA here, right? It's entertainment, it's Hollywood. So this affects everyone. We're in the front lines in healthcare, but even with the Oscars, thinking about how do you safely bring people together for the Oscars in 2021? How do you how do you do movie production still in the era of COVID
Right.
and pandemics when you can't have people on set? So I was fortunate to advise the Academy Awards over their deliberations of thinking about the Oscars for next year, and also just how to restart kind of the movie industry and how's that done safely, if at all, in the middle of a pandemic. The Super Bowl is thinking of changing dates. They have a backup date potentially in late February. The NBA playoffs, they're thinking of maybe holding back from starting those in Florida again because
Right.
of what we're seeing. So it's like, it's touched everyone's lives across kind of the sectors, so
Yeah.
we're seeing all of this. And
Realistically, what is the conversation that we should be having right now? I would probably say a month and a half ago, everyone was talking about reopening. I think we were on phase four in
yeah,
California, which was like in some places people are going back to gyms. What is that conversation at like right now?
yeah, you were so right, Harrison. I think we got very optimistic very quickly. I mean, all of us did. We were hoping, we felt like maybe we hit that first, we passed that first surge, but the conversation really now, I think people are settling in to the reality that we are going to chronically coexist with COVID.
Mm,
Like we are for the near term, the next 3 to 6 months till there's a breakthrough vaccine, and we get to that point. So how, as one of my colleagues said, how do we navigate the guardrails, the two guardrails? This guardrail is complete shutdown, no economic activity, no going outside, no human interaction. This is deemed been rather very difficult and impractical in many ways. People's livelihoods depend on the economy, right?
right.
The other guardrail is complete normal human activity. And we know the virus has not changed. The virus is the virus. And so it's going to continue to infect people if we just go completely back to normal. So how do we straddle this zone? How do we stay safely in this area without fluctuating up here and loss of life, and fluctuating down here on society's economic activity and our own mental health to interact
Right.
with people? So that's really where the
Mm,
conversation is now, is how does each state, each community straddle these guardrails of chronic coexistence with COVID? We are
mm,
in that phase now. We had that acute phase, and God forbid we go to another severe acute phase, which could happen, a second, third wave. We don't know. So how do we stay in those guardrails, those guard posts,
yeah.
to keep that balance? Because each decision has a trade-off.
Yeah. Is it too early to call this like a second wave? Like, I mean, we're hitting numbers that where we were at like back in March and April.
Yeah, Harrison, that's such a good question. We're hitting higher numbers, my
Yeah.
friend. We are higher numbers, Harrison, like you said. So you could almost say this was a first wave that plateaued and is resurging, or it's kind of semantics. You could say it's a second wave. It's really a tail off from the first wave that what we saw is this, and then a plateau, and
Yeah.
now we're seeing this.
Mm,
And the challenge in this country too is we have 50 different states and 3,400 different counties.
yeah.
And so you have county governments operating, and then you have state governments operating, and then you have the federal government. So it's almost like we're in 50 different countries. And this virus has no respect for boundaries and borders, right?
Yeah.
It's, if there's a human, there's a host potentially biologically for this virus. So I think that's a big challenge, is we're also all operating kind of as different states, but this virus sees us all as potential human hosts. So
Mm,
that's kind of where we're at. And so, yeah, you could say we are seeing this resurgence, and we really need to turn the table, because this could result in tremendous amount of loss of life. We're already seeing, Harrison, Houston's out of ICU beds.
mm,
I mean, that's the third or fourth largest city in the country, in the United States, doesn't have an ICU bed.
mm,
What if someone has, God forbid, right, a heart attack, a stroke,
right.
severe septic shock? Where are they going in one of the largest cities in the country? So this has the potential to get out of control really quickly again.
Yeah. Maybe let's talk about the demographic side, right? Because I think like early on in the conversation, uh, there was sort of an emphasis on, the elderly population in the US. And we saw sort of like that outbreak really devastate, nursing homes, multi-generational families with older individuals. have those numbers started to change? Like, has treatment started to curve a little bit of that, or like where are we seeing sort of the resurgence of these cases primarily happening?
Yeah, it's happening in us, my friend, in us,
Mm,
in young folk. It's happening in folk in their 20 and 30s, into their early 30s. So it's us now,
mm,
which is really a challenge because I'll give you a quick example. In Florida, the average age of a COVID positive person in March was 65, Harrison. 65, an elderly individual, right? The average age in June in Florida, you know what it was?
20, 21?
35.
Oh,
Yeah,
35.
yeah,
Oh,
exactly.
25,
35,
20. Oh, 35.
35,
Wow.
35. So
Wow.
30-year difference between
Mm,
who was getting infected in March in Florida and who's getting infected now. California, same thing, bro. You and
mm,
me, we're in California. We're in the two of the largest cities, along with San Diego, right, in California.
yeah.
44%, Harrison, 44% of the infected cases this last month of June were in those under 35 in California. Almost
Mm,
half of all the cases. So the challenge, and you know why that's so tough? Because we're also the ones who are healthier. So we're passing it on in mild and asymptomatic cases. The silver lining is that we don't get sick as much as the elderly, but we pass it on. The opposite lining is that we're passing it on without even realizing it a lot of times,
mm.
because half the cases are asymptomatic. So we're seeing big demographic shifts from what was infecting people back in March and April to now.
Mm. So we're just out here wilding.
We're wilding.
What are
We're
what are
wilding.
what are those what are the types of activities like we've had, there's obviously been a ton of protests. We've had people go to spring break on beaches. I think some places you could go to restaurants. Like what are sort of like the primary like violators if you were to kind of like rank them?
Yeah. Are we going to Cabo for the fourth, Harrison?
I don't know about all that.
No Cabo for the fourth,
Yeah,
bro. No, you're right. But people are thinking, right? But people want to.
yeah,
It's the summer, and I'm in SoCal, right? It's the summer. You want to be out. You want to be with people. And I'll be honest, people are exhausted of shelter in place. I
yeah.
mean, I hear that, and so I mean, it has affected me too, right? Like none of us want to have that. Have been in that mentality of complete shelter at home for months and months, right? It wore on all of our souls.
Mm,
And so what we're in terms of, that's a great question though. How do we think about risk? So what I generally tell people, if you had to take away three variables, it's space, time, and people.
mm,
And you want to maximize space, minimize time, and minimize people. So let me give you an example. You're on a jog. You're running in the Bay Area. I'm running in SoCal or the Hollywood area around Griffith Park, let's say 30-minute, 1 hour jog, just myself outdoors. So space, lots of space outdoors. No one else is around me. Not too bad time, 30 minutes to an hour outside, and just myself, one person. Pretty low risk. Now, let's say it's 4th of July, we're barbecuing, right? Let's say you, me, and MC and Tosh and our buddies all get together, 3 to 5 of us, barbecue outdoors and closed area, right? So now we're saying there's the space is not like all outdoors, it's like an enclosed outdoor backyard or patio, right? So smaller space, more people, 3 to 5 of us instead of just one person jogging, and more time together, 2, 3 hours for a barbecue, right?
mm,
Together. So more medium risk. And then you have things that are very, very high risk, like a wedding, right? Like, unfortunately, all those plans have had to be put on hold. Or a Lakers game. I'm near the Staples Center here in downtown Los Angeles with thousands of people, indoor space, thousands of people, and 2, 3, 4 hours to watch a sports game or for a wedding. So there's a whole risk of gamut of activities. We want to avoid the high risk activities as much as possible. You want to stay in the low to medium risk for the sake of your health and everyone else. So
right.
the takeaway really is maximize space, minimize time, minimize people. The fast rule is outdoor better than indoor, less people better than more people, less time better than more time, and mask better than no mask. That's the rule of four.
Mm. So if I wanted to hop on an airplane, what kind of risk factor is that? And also too, if I was in one of these high risk sort of situations, like what are the steps that I can take to make sure that like, I'm safe and I'm not endangering those around me?
Yeah, and Harrison, that's a great question. I was supposed to be in Iowa this week, bro.
Mm,
Um, I know you're thinking about how to safely visit your folks, right, in the
yep.
Midwest. Your folks are in St. Louis. My folks are in Iowa. I was supposed to be home last week. Through this week, I had vacation, and it's just put us all in this like a state of kind of uncertainty and anxiety. So what I've been telling my friends who've had to fly is wear a high grade medical mask or an N95 if you can get your hands on it. Some of the cloth masks are not at all effective,
Mm,
20-30% effective. So if you're able to, cloth masks in day-to-day activity is okay, but the safest, even in day-to-day, is surgical or medical masks. And then lots of disinfectant. And you just want to, unfortunately flying, you're right, you're in an enclosed area with 100, 200, 300 people. If one person, Harrison, has COVID, the whole plane could end up with COVID by the end of it. I mean,
mm,
I'm just being honest. Give you an example. The Diamond Princess ship, remember that outbreak
yeah.
originally? There were 3,000 people on that ship, Harrison. You know how many ended up getting infected? About 700. One out of four were positive
Mm.
from that cruise with COVID. And you know how many had no symptoms? 400. About half of
Wow.
those 700 had no symptoms. So you could get on a plane, get off, and have COVID and not even know it. That's still a possibility. So I would just, the risk on any one flight is low,
Yeah.
but if enough people are flying, someone's going to get it. So I don't want to raise up unnecessarily, the fear out of that. If you need to fly, you got to fly, right? So wear an N95 if you can, or at least a surgical mask. Any surfaces you're touching, the door, the cabin, the tray, table, disinfect after any high touch surface, the bathrooms. We know COVID can raise out of the air from flushing
Oh,
the
wow.
toilet. Toilets
Wow.
are high risk. Yeah,
Wow.
yeah.
Toilet, like what are some uncommon or things that I wouldn't expect that are high risk? Like I've never heard that before.
Flushing is high risk actually.
Wow.
So we're still learning more,
Yeah.
but I'll give a study. This just got published 2 weeks ago.
Yeah.
They looked at all the high touch surfaces in households of 21 people with COVID. And most surfaces actually did not have COVID. The high touch ones like doorknobs, only 3% had COVID in the
Mm.
household with a COVID person. 3%. But you know what? The highest was 15% in the bathrooms.
Wow.
So the bathrooms, surprisingly, are the highest risk when you're around someone with COVID. The wastewater, the flushing mechanism can aerosolize particles temporarily.
Mm.
And the common touch surfaces of the toilet when you flush and the faucet, right? So bathrooms are a bit high risk. Something surprising too is animals get COVID. Toshiko was asking that. So we've shown that cats and dogs can get COVID from humans. We don't know that humans can get it back. We don't know
Mm.
that we can get infected or reverse from animals, but they did an experiment. They injected 3 cats with COVID in their nose, and then they put 3 uninfected cats, one uninfected cat with each COVID cat together in a little shelter, a house. So infected and uninfected cat, infected, uninfected, infected, uninfected. After 6 days, all uninfected cats had COVID
Wow.
from the other cats. Um, in dogs, they also did an experiment. They looked at 15 dogs that were with 15 COVID people in the same apartment unit, household. And after 2 weeks, 2 of the dogs were COVID positive out of the 15.
Mm.
So it's more transmissible in cats than dogs, but dogs can get it. But the caveat is dogs and cats tend to almost be completely asymptomatic or very mild. The cats who got it had a little loss of appetite, and that was pretty much it. So very minimal symptoms for animals, but it's very interesting. I guess the point of this is we are learning new and surprising facts of COVID all the time. We probably know 30% right now of COVID, even 4 months into this, of all the knowledge there is to learn about COVID. We're going to be learning about COVID for years.
Wow. Cool, man. So we'll probably have about 10 minutes left. If you guys have any questions, feel free to submit those. We'll kind of uh, go about those here pretty soon. Atul, give me your.
Harrison,
Go ahead.
you're a cat.
Oh yeah, I have a cat. Yeah, yeah, exactly.
Hope
Nah.
you keep the cat safe on the flight.
Yeah, that's gonna be interesting. What?
Put a surgical mask on the cat.
Yeah. Well, I'll Amazon that. So hey, man. I'm just gonna kind of do it like a hook for you. So make sure you guys follow Upple. He has something that he calls the COVID minute. I'm gonna put you on the spot today. What's the COVID minute for today?
Yeah, the COVID minute for today, man, was whether the cases rising, the skyrocketing cases, were just because we're testing more or it's actually spreading more.
Hmm.
And that was a big, I mean, Harrison, brother, Mike Pence, right? Even the vice president of the United States was saying it's testing, testing, testing. Elected officials, there's so much confusion. So I try to, thank you for the shout out, man. I try to break it down. I keep it to a minute to two, simple and factual. Like, what do the facts and evidence say? And so
Hmm.
today's version was on, is this all just we're testing more or is it really spreading more? So yeah, definitely check it out, Nakasi underscore MD, and check out Harrison's podcast, man. The latest and the greatest.
Appreciate that. Yeah, and this is a special edition, not design related, but I think this is just as important. So we have a few questions in right now. I'm going to do, this is from Ishan. So, is eating at an outdoors restaurant risky?
Great question. Less risky than indoors. So if you had to eat anywhere, definitely would ask to be seated outdoors.
Mhm.
Much more open space, going back to that space-time people. But to be honest, Ishan, great question. I would do takeout. Restaurants themselves still are a high density kind of area of people, right? Like dinner tables, people are coming together. And I'll be honest, we did inspector checks, the Department of Public Health did. Only 40 to 50% of restaurants were not maintaining social distancing between tables.
Mhm.
So the safest would be actually getting takeout from a restaurant. But if you had to eat at a restaurant, outdoor better than indoor. Good question.
I'm going to look at this one from Justin since it's right at the bottom. Where can people go on the internet to stay educated and up to date with COVID info?
The COVID minute, man. No, I'm kidding. That's a great question. The CDC website is very reliable. I get a lot of information and data on that. It can be a little overwhelming at times, but it breaks it down by like travel, workplace, different industries, taking care of a loved one or caretaker who has COVID. It actually has quite a few different topics. It's actually very thorough. If you go to the CDC COVID website, it's very thorough and has the most asked questions as well. So I actually find that I use that myself as a physician as well. So if I had to plug any resource, it's the CDC's COVID website.
All right, Cindy, hey Cindy, are picnics with friends a high risk activity?
Cindy, so awesome to see you. Love the question. A great question. So picnics generally safer, but I would keep it to 3 to 5 friends, socially distance, and stay outdoors. And that'll be kind of that low to medium risk. It's kind of like that outdoor barbecue with 3 to 5 people. So great question. If you keep it outdoors, you distance, you keep it to 3 to 5 folks, that's more low to moderate. But the other thing is just be honest too. If any of your friends have had fevers or symptoms, they should definitely stay home just to be safe. So you also want to kind of make sure everyone who might be sick is staying home. But picnics with small groups of people, not as risky.
All right, I'm going to go from the bank here before I get the folks that are posting right now. So, Josh, are there any plans for filming and production?
Yeah, great. And just one more thing on Cindy's question. I should emphasize that we are in an era where there's no zero risk activity anymore.
Hmm.
So there's always some risk. Even when I say something's low or moderate, it might be that 1 out of 100 time where someone does get COVID. So I think, Harrison, that's kind of a tough concept for all of us. We have to be comfortable being uncomfortable coexisting with COVID.
Hmm.
That's kind of the takeaway. One of them is like, we now have to be comfortable being uncomfortable with it all around. So I wish I could say this is completely zero risk, this is completely safe. We just can't because it's still around. So that's just a caveat for all how to think about risk. Like there's always some risk, but how do we minimize it?
Yeah.
So filming and production, they just announced they were gonna allow filming and production again here in LA. But now with this resurgence, the governor and I think the safety overall, a lot of that is going to be on hiatus again, unfortunately.
Yeah.
And they allowed movie theaters to open. They just told them to close down again today. So I'm sorry to say those phase 3, phase 4 activities, Harrison, like you were saying, are probably going to have to be slowed down.
Yeah. I probably imagine that, the NBA and MLS, I know they were considering resuming, but I don't know. I don't think these things are going to happen.
Yeah, there were just 3 new players, right? I forgot which NBA team were positive again.
Yeah.
On the news, last week even. So they're definitely not without. They're not going to be with fans at least,
Yeah.
and maybe they'll get around to doing it a safe way with just the 10 players on the court, right? 5-on-5.
Right. Adela, what's up? Is it still safe to go for annual checkup at hospitals and dentists?
Yeah, that's a great question. What I would do, and that's a popular question right now. Great question, Harrison. It's been scary. 35 to 40% of people with strokes have not showed up during
Whoa.
COVID. Same with appendicitis. Same with pneumonias from non-COVID related pneumonias, just pneumonias otherwise. So that's a great question. We are seeing a stunning drop of people coming for care, even for life, like survival care, like life critical care, right? And so all of us in medicine are like wrapping our minds around, where are the missing strokes going? Where are the missing appendicitis going? Where are the missing pneumonias going? We don't know. And so it goes to this question, is it safe? So there's a lot of fear around COVID, but what I would say is health systems are taking a lot of precautions. For example, we are only bringing back 1 out of 3 patients in person. 2 out of 3 are all on the phone. So what I would say is call your doctor, ask what their policy is. Are they bringing people back together? If it's a low risk area where transmission's not going back up like here, and they have good PPE, they have good precautions, they're distancing their waiting chairs, they are screening people outside for symptoms before they're letting in, I would ask all those questions. I would ask, how are you protecting patients who come in? That's a fair question to ask because you don't want to be in a highly vulnerable, exposed area. So I would say it's an individual decision. Talk to your doctor and ask them, how are they protecting patients coming in for routine care? Because we don't want you to miss routine care. 40% of children, Harrison, miss their immunizations. So it's a tough challenge. I wish there was a clear-cut answer.
All right, so we have time for a few more. This one, should we sneeze in our mask or take it off and into our elbows? It's a great question. It's pretty awkward sneezing in a mask.
Question. Who asked that question? Great question. Thumbs up to the question. Both. Keep your mask on and then go into your elbow. That'll be the highest. So the mask is going to capture the vast majority of the particles, and anything that sneaks around the mask will go into the elbow at least. So do both. Don't take off the mask. Sneezes, Harrison, you know how far sneezes go?
You tell me.
I'm putting you on the spot. I'm playing. Bro, 27 feet.
Oh, whoa.
That's like for me to you, I'm playing, but it's going far. It's going far. So sneezes are high risk. Coughs are about 6 feet, even respiratory particles. Sneezes 27 feet, folks. So for sure, keep the mask on and then do the elbow.
We got some good questions, so I'm gonna probably cap them for now, but we'll try to get through these. Maybe we can do quick fire. So, are gloves actually effective at grocery stores?
Right now, gloves are not recommended unless you're caring for a loved one or caregiver or who has COVID. So that's CDC guidelines because gloves can contaminate surfaces and your own body and your own face. So at the moment, public health advice, gloves when you're caring for a COVID positive person. Good question.
Got it. Justin, are you able to provide any insight on the accuracy of testing?
Yeah, it's super wide ranging. Antibody tests, half of them are wrong. Can't be reliable. The antibody tests, there's no good accuracy level for half of them. Half of them are good, half of them are not. The swab to test for actual COVID infection through the nose and mouth are pretty good, but even the nose one misses about 25 to 30% of infections. So I'll give a quick story. I had a patient, she had cough, fevers, chills, muscle aches. She got the test. I got her test back, Harrison. This was 3 weeks ago. It was negative. I
Hmm.
told her, good news, your test is negative. Bad news, I still think you have COVID. Self-isolate 10 days and quarantine everyone around you for 14 days. So it speaks to the fact if you have symptoms, talk to your doctor, because the test, even the swab one, misses 30% of cases, and the antibodies have their own challenges with a lot of false positives telling you you got it or might be protected and could be wrong.
Right. So even with the numbers that we're seeing right now, they might actually be even lower.
Yeah.
Hmm.
Yeah. So both things. So there are a lot of asymptomatic cases. So some of the numbers are way higher from cases we're not even detecting.
Yeah.
And then the antibody tests, you're right, are telling people, way too many people, that they may have had it already when they may not have. So it's
Hmm.
both ways.
False positives, false negatives.
Exactly. It's a little tricky, but false negatives with this and false positives with the antibody
Right.
blood.
Right. All right. So last question. What types of cloth masks are ineffective?
Great question. There was a study, it came out about a month ago. It took mask fabrics and shot aerosolized particles through them and then caught what came through in a lab setting. So, caveat, it was not done on real world setting, real human setting, but we learned a lot from it still. Low thread count cotton, Harrison, like maybe my shirt, your shirt, like our clothing, right? Low thread count cotton potentially was only 20% effective at blocking those particles in that machine from this side to that side. 80% got through. So most of our cotton, low thread count, like 60 TPI threads per inch. High thread count cotton, 800 TPI, very effective. Very effective. So what you want, like 70+%. Surgical masks, 77%. So if you want a good mask, you want high thread count cotton plus a layer of silk on it, because then you have two properties blocking the particles. So a combination of high thread count cotton plus silk was 90+% effective.
Hmm.
So
Well,
two or three, the takeaway, 2 or 3 layers, high thread count cotton plus something else.
got it. Cool. Well, look, Mike has a hilarious question, but I'm not going to put you on blast like that. Um,
What is
uh, uh, Sorry, you see me? Cool. Well, hey man, I appreciate you coming on board. This was super enlightening. And yeah, any sort of last words from yourself?
No, man, Harrison, thank you so much for hosting. I hope this was educational. There's so much science out there. The last word I'll say is there's so much misinformation. It's like a pandemic within the pandemic.
Hmm.
They looked at YouTube, Harrison, top 69 videos on COVID. 25+% had fake news and misinformation, 1/4 of them. That translated, my friend, to 66 million views of misinformation.
Whoa. Wow.
66 million views. So, my friend, one IG Live interview at a time, we're in this fight, the pandemic of the pandemic, to fight misinformation and give people facts and give people truth so they're empowered for their well being and safety. So, that's the last word, my friend. Let's keep it up. Keep the faith, keep the faith, keep the fight.
Appreciate it, bro. All right, you take it easy. Good catching up. Bye.
Take care, everyone. See you, Harrison.